presenting the mechanism of labor in left occipital transverse as well as left occipital anterior positions. The lie is longitudinal, the presentation is cephalic, the attitude is that of flexion, the presenting part is the vertex, and the denominator is the occiput. So the diameters preferred in the fetal head are suboccipitobregmatic and suboccipitofrontal, that is maximum flexion, whereas the diameters preferred in the pelvis are either transverse or right oblique diameters, because the left oblique is unavailable due to rectum. So the transverse diameter is more common. Coming to that, the first cardinal movement is that of engagement, which occurs when the biparietal diameter crosses the pelvic brim. So as soon as engagement occurs, there is descent due to good uterine contractions and maternal bearing down efforts. It is followed or parallelly there occurs increasing flexion due to resistance by the pelvic side walls. As soon as the denominator, that is the occiput, touches the pelvic floor by Hart's rule, there is anterior rotation of the occiput by 2/8 of a circle so that it comes to lie behind the pubic symphysis. Because the neck cannot sustain such a amount of torsion, hence the shoulders also rotate by 1/8 of a circle. Then there is further descent and increasing flexion till the occiput hinges beneath the pubic symphysis. This is followed by further descent till the crowning occurs, and after crowning there is delivery of the head by extension, followed immediately by restitution due to untwisting of the fetal neck, and then by external rotation by 1/8 of a circle, which is due to the internal rotation of the shoulders by 1/8 of a circle, so that now they come to lie in the anterior posterior plane. Now there is further descent till the anterior shoulder hinges beneath the pubic symphysis. Then the posterior shoulder, anterior shoulder are delivered in succession, followed by the body by lateral flexion. So this was left occipito-transverse. Coming to left occipito-anterior presentation, it starts the same way. The lie is longitudinal, the attitude is that of flexion. Here the engaging diameter of the pelvis will be right oblique diameter, and the head will have the same suboccipitobregmatic, suboccipitofrontal diameters. The first step will be the same engagement, which is followed by descent due to good contractions, followed by flexion due to resistance by the pelvic side walls. Then there is touching of the occiput, the denominator to the pelvic floor, followed by internal rotation of the occiput so that it comes to lie behind the pubic symphysis. As the neck can sustain a torsion of 1/8 of a circle, hence there is no rotation of the shoulders at this point. Then there is further descent till the occiput hinges beneath the pubic symphysis. After that, crowning occurs. Then delivery of the head by extension, followed immediately by restitution by 1/8 of a circle. Then the shoulders will rotate internally by 1/8 of a circle, hence manifested externally by external rotation of the head by 1/8 of a circle. Then further descent till the shoulders hinge beneath the pubic symphysis. The anterior shoulder hinges, the posterior and the anterior shoulder bond in succession, and the body is bound by lateral flexion. Thank you.